Well, would you believe this? We're at the very last phase of pharmacokinetic, the one of elimination. And don't we feel like eliminating that chapter altogether right now? It's the unfortunate beginning of pharmacology to look at all these general principles. And we left with a tough one here. The processes of elimination. You know, to eliminate, most often we associate it with kidney function. And that's fine. Really, by far, we'll be talking about kidney function for elimination, although we know other tissues could be involved. There is a key definition. And the key definition deals with the half-life of a drug. The half-life of a drug, known as T1/2, is the time it takes to eliminate 50% of a given amount or 50% of the drug from the patient's body. And that half-life, we're going to look at whether it is constant or not to pretty much distinguish two forms of elimination. The two forms that are both relevant are what we call zero-order elimination versus first-order elimination rate. You will want for your exam to be able to define this in words, in case you have to match it to an appropriate statement, but also to define it in graphics. We'll see some diagrams about elimination, and even use mathematical correlates in numbers in order to define and distinguish zero from first-order rate. We'll start with zero-order elimination rate. A drug is said to follow zero-order elimination when a constant amount of drug is eliminated per unit of time. We say here constant amount. So we mean by this constant number of milligrams, if you want. We're not talking constant fraction or constant proportion. We're not talking percentages. We're talking amount of drug. I'll give you an example on the whiteboard, which is exactly the one you have in your syllabus, which is, imagine you have 80 milligrams at time 0, and imagine your elimination rate is of 10 milligrams, let's say, per hour. Then all it means is that 1 hour down the road, you'll lose 10 milligrams, you'll have 70 milligrams in the body. You wait another 1 hour, and you'll have 60 milligrams in your body. Another 1 hour, and you'll have 50 milligrams in your body. Notice, it would mean every unit of time, you're losing a constant amount of that drug. That's called first-order kinetic. If we think in terms of half-life, zero-order kinetic, let's imagine 10 milligrams per hour, constant amount per unit of time. How long would be a half-life if you have 80 milligrams of drug in your body? Well, what was the definition of a half-life? The time it takes for half of the drug to be eliminated from the body. So one half-life later, one T1/2 later, there should be only 40 milligrams remaining in that body. At the rate of 10 milligrams per hour, it would take me 4 hours for elimination of 50% of 80 milligrams. Is that half-life constant? Well, let's see. Imagine I didn't take 80 milligrams, but I took 100 milligrams. One half-life later, one T1/2 later, how much should stay in the body? Well, half of 100 is 50. If I'm eliminated as a constant amount per unit of time, 10 milligrams per hour, it would now take me 5 hours to get rid of half of the amount of drug in the body. If you go back to the computer screen, you see that drugs with zero-order elimination, therefore, have no fixed half-life, essentially telling you half-life is a variable. For the exam and for real life in the clinical world, what you would like to remember is that half-life is proportional to the amount that's in the body. The higher the amount of drug in your body, the longer it will take to get rid of 50% of that drug when you have zero-order kinetic. How about looking at this information in graphic? When you look at the information in graphic, you look at the plots of zero-order kinetic at the bottom of your page. You're looking on the left at the plots of units of drug as a function of time. And you notice that it draws a straight line as far as a constant amount per unit of time goes for elimination of a drug. Now that straight line gives the nickname of zero-order elimination as linear type of kinetic. And that linear kinetic, that straight line on a plot of units of drug as a function of time, is something to recognize and think of as being zero-order elimination. When does it happen, zero-order elimination? It's really unusual. It is something that occurs when enzymes are saturated, and enzymes are saturated when you have very high amounts of drugs in the body. That also therefore gives to linear kinetic yet another name, which is to call it saturation kinetic. So whether I call it zero-order elimination rate, linear kinetic, or saturation kinetic, I refer to the same process. A process whereby high concentrations of drugs in the body have saturated all enzymes, resulting in a constant amount of drug per unit of time being eliminated. You see that on that plots of zero-order kinetic, you have another curve on the right. That curve is not really useful in pharmacokinetic. It's useful for you to recognize on an exam question. The only difference with the curve to the left is the y-axis. On the y-axis, what is plotted here is the log of the units of drugs. If you transform a linear curve on the left with a log scale on the y-axis on the right, you no longer see a linear curve. You see basically that bowing looking type of curve. Its relevance will mainly be seen when we review first order kinetic as our next example of elimination. What is first order elimination? In first order elimination, what is being excreted by the body is a constant fraction, understand by this a constant percentage of drug per unit of time. Most drugs by far follow first order elimination rates. So this is the form of elimination to study the most as far as your exam is concerned. Remember, zero order was really for high dose of chemical when we have toxicity. Half-life being described as the time it takes to get rid of 50% of a drug will be a constant in first order kinetic. So we can even order our drugs in pharmacology based on their half-life, providing we are in first order kinetic. And that half-life will be related to the elimination constant K. It's related through an equation that we're going to have to understand. Before we get to the equation, let's prove to ourselves that if we have a constant fraction of drug eliminated per unit of time, half-life is a constant and not a variable as we saw previously. To do this, look at the whiteboard. Imagine I'm taking 100 milligrams of drug, and I know that one half-life later I will have 50 milligrams left in the body, because one half-life is defined as the time it takes to get rid of 50% of the drug. Let's imagine that this has taken 4 hours, just as an example. If I'm in first order kinetic, how long would it take for 200 milligrams to become 100 milligrams? 200 milligram, 100 milligram, 50% of 200 milligrams are gone when I have 100 milligrams left. So that's what I call one half-life, 1T 1/2. And if I'm losing 50% of a drug every 4 hours, 200 to 100 will still take 4 hours. It won't change. It won't matter how much drug is in the body. As long as I follow first order kinetic, it always takes the same amount of time to get rid of a constant fraction of drug. It so happens that right here we're focusing on the 50% fraction, which is what we call the half-life of a drug. If I had 300, it would take me 4 hours to get to 150. If I had 50, it would take me 4 hours to get to 25. A constant proportion is eliminated per unit of time. You see the difference with the previous case in zero-order kinetic earlier on. Every time we increased the dose of drug, we ended up with a longer half-life. Half-life was a variable because we were eliminating a constant amount of drug per unit of time. Here in first order kinetic, we have a much more efficient way of working, whereby in the body, no matter how much drug is present, it always takes the same amount of time to get rid of 50%. Of course, how long does this remain true? It remains true as long as enzymes are not saturated by excessive amount of drugs. As long as you don't have saturation, you're in first order kinetic. If you're saturated, don't forget you go to zero order kinetic. Well, let's look at this on diagrams. Look at the plots of first order kinetics in your book or on the computer screen. In your books, they're at the bottom of the page of that section also. First order elimination rate, first on the left, you see the classic plot of units of drug as a function of time. This time you're noticing no longer a linear curve, rather an exponential decay. If this was 100 at 4 hours, then 4 hours later you'd have 50, 4 hours later you'd have 25, 4 hours later 12 and a half. You would just keep on going down in proportions. That exponential kinetic is classic of a first order rate. Exponentials, scientists don't like those too much. Imagine you had to do the experiments of taking samples of drugs in biological fluids and then make that curve. Because it's not a straight line, you would have to take as many measurements as there are points on that curve to draw it accurately. Contrast, a straight line, all you need is 2 measurements and only one straight line goes through 2 points. So mathematicians are very quick to figure out that a decaying exponential, all you need to do to linearize the data on the right hand diagram is to put the y-axis as a log scale. And on a log scale, you would now see that your exponential of first order elimination is now a straight line. So you know the problem with your exam. If I backtrack a little bit, the big issue is when you see a straight line as a curve, is it zero or first order kinetic? Well, you know the answer will rely on looking at the y-axis and the scale. If on the y-axis you purely have units of drugs, not a log scale, then a linear kinetic is zero order and you're losing constant amount per unit of time. If on the y-axis what you see are log units of drug concentration and you see a straight line, then in that situation you're in first order elimination rate, an issue where you're losing the drug as constant proportion per unit of time, the more common issue. Let's take an example of this. If you look at the plot called plasma decay curve first order elimination for the graphic analysis of a half-life, you can use the graphic to first assess whether you deal with first or zero order kinetic, then secondly to actually calculate the half-life based on the graphic information. You know the exam loves to give graphics every now and then. First point then, look at the y-axis and figure out, is this a log scale or is this a normal scale? Let's look at the whiteboard 1 second. Let me show you how to really recognize well a log scale versus a linear scale, and just in case, because I know we're always rusty with math, aren't we? Now, you see a linear scale, number one, it generally starts at 0. A log scale will never start at 0. Actually, if you want to kill a mathematician, the best bet is to tell them log of 0. Normally they drop dead. It doesn't exist. So if you see a y-axis starting with a number 0, you already know it's not going to be a log scale. And on a linear scale, not only it could start at 0, but when you look at the space between numbers, well, the space is even. Between 1 and 2, there's the same space as there is between 2 and 3, the same space as on 3 and 4, 4 and 5, and so forth. If your curve is linear on such a scale, which is a linear scale, this is zero order kinetic. Let's contrast this, therefore, with the curve you have right now in the book and on your computer screen called graphic analysis of half-life. Look at that y-axis. Number one, as mentioned, it does not start at 0. If it does not start at 0, you know that probably it could be a log scale on your actual exam. It starts at 1. Then you look at the space between 1 and 2 versus the space there is between 2 and 3, 3 and 4, 4 and 5, 5 and 6. You see that the spacing between the gradation is slowly decreasing. Certainly not even, such as on the linear scale that we placed on the whiteboard previously. That's the hallmark of a log scale. As a matter of fact, you may want to remember also that after 10, your next point would be 20, then 30, 40, 50, 60, all the way to 100, then 200, 300, and so forth. Recognize well that log scale, because if you see a log scale on the y-axis and a straight line for elimination, you're dealing with first order kinetic. So that's the first point about analyzing that diagram. Now, as to trying to find the half-life as a value, how many hours does it take to get rid of 50% of the drug? Well, it's fairly simple to use that diagram. You know that one half-life is the time it takes to get rid of half of the drug. Let's take an example. Let's imagine that to start with I had 4 micrograms per ml in my blood. What time was it when I had 4 micrograms per ml in the blood? Well, I'm going to look at 4 micrograms per ml on the curve. And as I get to the curve, I'm going to look at what time it was when I was at 4 micrograms per ml on the x-axis. And I'm going to see that it was 3 hours down the road when I was at 4 micrograms per ml. One half-life later, those 4 micrograms per ml will have become 2 micrograms per ml. A half-life is the time it takes to get rid of 50% of the drug. So what time was it when I got to 2 micrograms per ml? If I go to the curve and then look at the x-axis, occurred at 6 hours after administration. Therefore, it took between 3 hours as a time point and 6 hours as a time point for one half-life to elapse. No doubt, one half-life is 3 hours long. Look at another point we can prove to ourselves here. What if I had started with 6 micrograms per ml, then a half-life later I would be at 3? How long would it take if I'm in first order kinetic? I remember half-lives are constant. 6 micrograms per ml occurred slightly after 1 hour. 3 micrograms per ml, if I go to the diagram, occurred slightly beyond 4 hours, so that the half-life is again 3 hours. No doubt that half-life is a constant in first order kinetic, and graphically I can determine the value of that half-life. Final point with that diagram: is there a relationship between half-life and elimination? Well, there should be one intuitively. When you think of elimination, if it's very, very fast, so elimination would be a big number, if you want, a great number, very fast, very large elimination. How long do you think your half-life should be, the time to get rid of 50% of a drug? If elimination is very fast, it should take you no time at all to get rid of 50% of a drug. So half-life should be very short when elimination is very fast. Vice versa. If elimination is very slow, you have very little elimination, so elimination is a very, very small value, then it's going to take you forever to get rid of 50% of the drug. So that half-life is going to be enormous when elimination is very slow. It means simply that elimination and half-life should be inversely related. Let's look at the whiteboard 1 second. The parameter of elimination is called K. It's a constant. Really, it's the slope of the graphic we've just been working with. Half-life, you remember, is called T1/2. They are inversely related. Therefore, I know that K would be at the denominator when half-life would be at the numerator up there, or on the left side of the equation. The only little problem we're going to encounter is that T1/2 and K are inversely related, but they're inversely related by a parameter of 0.7. 0.7, no unit, it actually comes from log of 50%. Don't worry too much where it comes from. Your key point is that there is a key relationship between half-life and elimination, which is the fact that if elimination increases, half-life decreases. If elimination decreases, half-life increases. Half-life and elimination are inversely proportional. Now you remember you already saw another equation earlier on, which was concentration is dose over volume. And it was concentration at time zero. Those are two very important equations of pharmacokinetics. Ultimately, we'll see 6 of them, but that's 2 of them that you must know and you must be able to relate to. Dose and concentration are directly proportional. You increase the dose, you increase respectively and proportionately the blood concentration. Half-life and elimination are inversely related. How could I work this out in a board question? Hey, imagine I tell you drug X is eliminated by the kidney. How many kidneys do you have? Hopefully, you're not one of these rare individuals who end up with a single kidney with maybe unilateral renal agenesis. That would be a little troublesome for my issue. Normally, with your 2 kidneys, you imagine that elimination is pretty much 50% from the left kidney, 50% from the right kidney. If we think of this, then if a drug is purely eliminated by the kidney, what would happen immediately after renal surgery? Let's make it a clinical vignette. I'm a heavy smoker, I'm 65 years of age, I started to have a flank pain, palpable mass, and I'm diagnosed with some hematuria. On MRI, big old mass at the apical pole of my left kidney. I hope you're thinking renal cell carcinoma, maybe a clear cell carcinoma. Check out your kidney pathology, for instance. Well, imagine the surgeon removing that one kidney. What would happen to elimination? If I remove one kidney, my elimination goes down by 50%. I cut my elimination by 1/2. If that's the case, in turn, what would be the result on the half-life of the drug? If I cut K in half, I must double the half-life of that drug, since K and half-life are inversely related. As usual, this is the way to look at these equations. Again, the exam may give you some numbers to plug in those equations, but by far what they're more likely to do is make you work in proportions. In other words, not make you calculate, but make you derive what happens to one parameter if you decrease or increase the corresponding parameter by so many folds. Make sure you can do this. A final point is, what are the units of K? We know the units of half-life. These are in units of time. An example, hours. Well, strictly speaking, the units of K then must be in literally per time. Per time, like hours to the -1. I don't know about you, but units of per time means absolutely nothing to me. Something that would be 0.0046 per minute without telling me what per minute is not going to be very useful. And that's why on the next step, what we'll be doing is replace that parameter K, which is more practical for mathematics than anything else, with the parameter of clearance. Clearance will be something that we can relate to concretely. You remember in the previous step, we finished looking at elimination and half-life. We related them to each other, saying that half-life was inversely related to K, the elimination constant. And we were thinking how K really was not a very practical parameter, in being that its units are given in time to the -1, which doesn't tell us much. So really, when we look at renal elimination, you notice that renal elimination by itself is a combination of glomerular filtration rate, GFR, but also the processes of secretion and reabsorption. Those processes refer to the drug molecule having been filtered in the renal tubule and either going back into the bloodstream, that's called reabsorption, or as you know, secretion would be other molecules bypassing glomerular filtration but reaching the kidney tubule through secretion directly from the blood vessels, such as the vasa recta, into the renal tubule. When we look at the rate of elimination of a drug, we could understand that all three parameters, GFR, secretion, and reabsorption, play a role down the road on how much of a drug will be eliminated from the body. The parameter that is much more relevant to use and much more conventional to use to look at elimination is the parameter of clearance. By definition, a clearance is a volume per time. You remember, for instance, we talk about renal clearance of inulin in Physiopath as being about 120 mL per minute. And all this means in Physiopath is that if we look at a compound such as inulin, which is freely filtered but not reabsorbed or secreted, every minute 120 mL of our blood would be cleared from the drug. Essentially, imagine a little volume of 120 mL of blood. Any amount of inulin in those 120 mL would be removed by kidney function every minute. Well, if you want to generalize this for any drug, you would say that the clearance of drug X is the volume of blood cleared of that drug X per unit of time. Now, clearance has the beauty of being a constant in first order kinetic. And we can, just like we classify drugs based on their half-lives, we could also classify drugs based on their clearance. Clearance encompasses all three parameters that occur at the level of the kidney function, namely GFR, secretion, and reabsorption. And the renal clearance of a substance equals GFR when there is no reabsorption and no secretion. However, we have one parameter that we need to bring in for pharmacology that we don't talk about enough in physio, really, which is that of plasma protein binding. As far as the portion that goes through GFR, there is no doubt that a protein-bound drug is far too large to be freely filtered. This is why on your slide you see that 0.5 tells you that the clearance really is the free fraction of that drug times the GFR, essentially reminding us that protein-bound drug is not cleared. So when is it that clearance equals free fraction times GFR only? Well, when there is no secretion, no reabsorption of that drug. Well, let me give you an example and look at the whiteboard a little bit. Imagine I tell you that a patient has a normal kidney function, and with a normal kidney function, you would expect a GFR, let's round it up, of about 120 mL per minute. If I further tell you that drug X is actually renally cleared, and drug X is 50% protein bound, then my first question for you would be, what would you expect the clearance of drug X to be? And that would be theoretically if there was no secretion, no reabsorption. Then you know the renal clearance of drug X would only be associated with a GFR function. Because it is 50% protein bound, only 50% of the drug would be free and amenable to filtration. If normal GFR is 120 mL per minute, then the renal clearance theoretically of drug X would be 50% of 120 mL, and that would give you a theoretical clearance of 60 mL per minute. I'm saying theoretical clearance because most drugs, of course, are also to a certain degree secreted or reabsorbed. So what we're going to imagine now is that you've already reviewed your tapes of physiology. If you haven't, you'll see this in renal phys. And imagine that there was a calculated clearance of drug X. And the way we calculate that clearance in physiology is to take the urine volume and measure the urine concentration of drug X. We're going to call it UX. That's the urinary concentration of drug X. We're going to divide it by how much of that drug X is left in the plasma. We're going to call this PX, and therefore have the ratio of extraction in the urine of whatever was in the blood, in the plasma of that patient. And to have it as a volume, we're going to time all this by the volume of urine over 24 hours. You know, what the physiologists will call U times V divided by P. And for that matter, imagine that really the number that was found using the real values was 30 mL per minute. What could you tell me when you look at a calculated clearance being 30 mL per minute versus a theoretical clearance where GFR alone would have played a role being 60 mL per minute? I hope as you look at this discrepancy, you realize that if I'm only clearing 30 mL per minute in reality, then I must have reabsorbed some of drug X. And using the two equations, the one from pharmacology and the one from physio, allow us to have an idea as to what percentage, what fraction of a drug might be secreted or reabsorbed. If the calculated clearance is less than the theoretical clearance from filtration alone, significant reabsorption has occurred. Here, half of the drug is being reabsorbed. To the contrary, if the calculated clearance is in excess of what you would have theoretically have found from GFR alone, then you would conclude that secretion is an important parameter. Final point about clearance. There has to be a relationship between clearance and elimination. As a matter of fact, intuitively, the faster the elimination, the better the clearance should be. So you would expect that clearance and elimination should be related to one another. Now, you know, for relationship to work in math or physics or any type of relationship you want, units must agree. And to us, really, I think if we focus on units for these equations in pharmacokinetics, it often tells us what the relationship should be. You remember the units of a clearance? Units of a clearance are given in volume per time. Now the question is, what do you call the volume in which the drug is? You call that the volume of distribution. There's your units of volume. And what should you do between VD and K, the constant of elimination, in order to relate it to a clearance? Well, remind yourself that K was inversely related to half-life, and therefore K is given in per time type of units. Therefore, if you time the volume of distribution of a drug with the elimination constant of that drug K, then you should have a valid equation relating clearance and elimination. Simply put, when elimination constant decreases, so does clearance. When elimination constant increases, so does clearance. So in turn, could you tell me what the relationship between clearance and half-life are? Could you tell me what the relationship between half-life and clearance is? You remember half-life is 0.7 over K. Half-life is inversely related to K. If K is directly related to clearance, in turn, clearance and half-life must be inversely related. Exactly the same relationship we worked on in the previous tape. Matter of fact, let's substitute K in this equation for a half-life. You would come up by combining the two equations with the fact that clearance is still the volume of distribution. Instead of K, you could replace it by 0.7 over T1 half. This is another valid equation of pharmacokinetic, which is easy to derive from the previous two. Clearance and half-life are inversely proportional. So what would happen if I would speed up clearance of a drug twofold? What would happen to its half-life? Hopefully, half-life would be decreased by 1/2. Inverse relationship between those parameters.